Here's Prime Minister's crucial COVID meeting with Chief Ministers of 10 states that's just begun. It's currently underway. Chief Ministers of Maharashtra, Uttar Pradesh, Karnataka, Kerala attend the Prime Minister's meet. Earlier, Prime Minister chaired one-hour meeting with COVID-empowered panel. The next Prime Minister's meet with oxygen manufacturers. Here's the Prime Minister taking cognizance, meeting with the worst hit states' chief ministers. In fact, right now, the chief ministers are currently in attendance include those of Maharashtra, Uttar Pradesh, Karnataka, Kerala, who are currently attending the meeting, among a few other states. Remember, several states are complaining of oxygen shortage, several medicines also, medical supplies that they are claiming a shortage of. Here's Prime Minister Modi himself taking cognizance to try and understand where's the shortage and what can be done with immediate effect. Earlier, the Prime Minister also chaired a one-hour-long meeting with the COVID-empowered panel. Remember, the empowered panels like the Niti Aayog, these are the panels who had to intimidate the government and the country on the impending COVID second wave. Coordination, it appeared, was lacking. At a time like this, the Prime Minister himself is now chairing a meeting, an internal meeting, to try and understand what has gone wrong and what can be done with immediate effect. Rahul Srivastava joining us live for more details on that. Rahul, the meeting now with the chief ministers of respective worst hit states and the Prime Minister is currently underway. Do we know as yet any discussion or decision that's been taken in that meeting? What's now being discussed in detail?
The Prime Minister in the morning at 9 a.m. till 10 a.m. met an internal group of members of the empowered groups which are there working on battle against COVID and took a complete brief on what exactly has been the scenario and changes in the last 1 year. Also the availability situations and all the measures which have been initiated in the last few months, especially in the last few days. Armed with the information that he has received, he is now meeting chief ministers and representative of 10 high caseload states, in which tops Maharashtra, Uttar Pradesh, Karnataka, Madhya Pradesh, Kerala, Chhattisgarh and others. Now, largely chief ministers are complaining about the lack of oxygen, medicine and others. Also, chief ministers are trying to convey how they have prepared in terms of coordinating with the center, what kind of arrangements are being made. What we are told that around 11:15, the Prime Minister will be making his comments in this meeting, and this comment by the Prime Minister may be telecast live as a sense of larger assurance being provided by the Prime Minister to the high case load states that what kind of action the center is initiating in terms of coordinating with the states, in terms of making available oxygen, medicines and others, and also how the center is trying to ensure that while battle against COVID cases is on, also how the vaccination drive can be stepped up. That's expected sometime around 11:15 in the afternoon, morning.
Right. Rahul, here we're looking at the Prime Minister himself taking cognizance. He himself is meeting with the oxygen suppliers as well. Now, where do you think, what has gone wrong here, Rahul? You did mention that the review meeting with the empowered groups took place a little earlier. Wasn't it their responsibility to alert and intimidate the government and the public at large on this impending second wave, the deadly second wave? And we hear there are mutated strains of the virus. What took them so long to alert the country?
Kamila, it seems that there has been a huge sense of complacence because of the numbers which are coming down last year since November, that by January we had very low numbers, and there was a sense of complacence because of those numbers. And it seems from the ground below, the information generation, the red alerts, the flags did not come up. The states did not look into their own affairs. And I think the center, which was largely acting as a nodal coordinating agency, somewhere there was a lack in terms of more hands-on approach for the crisis. Till the numbers really blew up in the face of the state and the center, virtually there was no action. If you see, for example, Maharashtra, which was contributing virtually 50% of the cases and the deaths in the country, in that state, the letter in terms of oxygen from Chief Minister came barely a week ago, while the cases were mounting sometime in mid-February or early March. And that's what it seems. And also, tremendous amount of political one-upmanship and blame shifting was happening between the center and the state. And caught in all this was a large bureaucratic setup also, it seems, which there are several empowered groups after all in Delhi. The health secretary, the cabinet secretary, almost everybody has been, should have been on the task that there were some projections that the numbers may go up, and the numbers were going up. And it seems that there has been a huge series of failures within the system from the center down till the grassroots level in terms of district magistrates and others, and the hospitals also, that somewhere the system has lacked that sense of alertness and preparedness to flag a crisis and perhaps act on it.
Absolutely. Rahul, we citizens collectively are also equally responsible. On every possible platform, alerts were being given out to wear your face masks. Don't let your guard down. Don't be part of gatherings. But it seems like the moment the vaccines were rolled out, it was moment for India to rejoice. Maybe too late or too early for us to actually come forward and imagine that this was over. Thank you, Rahul. We're going to continue tracking